Hello, everyone, and welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. I'm your host, Javier,
and Andrea Gomez.
And today we are joined by Maura Torres and Analicia Zarate from Mothers Against Drunk Driving.
You know, Javi, these two ladies that are joining us today, I only have met one of them before, and I met her last month. As we were talking, she was explaining what she did for MADD, and I just thought that her delivery and the way she explained, the mission behind of what they do was so interesting. She got a direct invite for this podcast.
Gotcha.
Welcome, ladies.
Thank you. Good afternoon.
Yes, so I'm so excited to have you here because I really personally want to learn about what Mothers Against Drunk Driving does. How did this get started? I want to know about you too and the work that you do. So I don't know, whoever wants to start.
I go. I've been here, 5 years now with MADD. So I started back in 2021, shortly after COVID. And it was a job that I didn't think was ever possible because I've heard of it back in high school. But I was a parole officer before that and then worked over at the driver's license department. So I've been a state agency employee for 11, 12 years plus, right? And now coming to the nonprofit side with Mothers Against Drunk Driving, that's put a new perspective in advocating towards the prevention of underage drinking amongst the youth. And that's a big goal in my program on my side of MADD, right, compared to Analicia's. She's more of the victim advocate. I'm the program specialist. I'm more of a community liaison.
Okay. And Analicia, can you tell us a little bit, about yourself?
Yes. So yesterday was my 1 year anniversary with MADD. So I'm a newer employee, but I was a victim volunteer for a little over a decade. So 11 years before I became an employee. I have a different angle, I guess, or I came in with a different experience. I am a victim survivor. And so I'm able to now guide victims and survivors through this process.
I see. That is so interesting. And I mean, I don't know if you want to share or not, but I guess coming into any job, having prior personal experience as to what you're advocating for, whatever that experience is, brings so much because you already know what it feels like or like the inside of the problem essentially.
Right.
And so how did this program come to be?
So MADD was founded a little over 45 years ago. So in 1980, Carrie Leitner, she was 13 years old. She was on her way home when she was hit by an offender, a repeat offender. It was a hit and run. He left her, she flew 50 feet out of her shoes. She was left there to die, and he fled the scene. He was later arrested. But her mother, Candace Leitner, she was the founder of Mothers Against Drunk Driving. There was a conversation or conversations rather that were had, comments that were made to her, basically setting her up with expectations of this offender will likely see little to no jail time.
Like no consequences.
Right. And as a mother who had just lost her 13-year-old daughter, she was infuriated. And so she founded this organization, and we've been, our mission is to eliminate impaired driving.
I see.
And so it became her life's mission to.
Wow. And where did this happen that prompted, the program?
In 1983, it got started.
In 1983?
It got started, and then is
it a nationwide?
It
or
is nationwide. It's
okay.
national. It's up to Hawaii. It's up to Puerto Rico.
I see.
So it's in every state.
Wow.
And we're trying to spread out. We don't have a program specialist and a victim specialist per se in every state, but it's in the works. So it's in the works. A lot of the states do have at least one. Unlike here in Texas, Texas is so big. For my side, there's only 7 of us. In your side, there's how many?
I don't know the exact number, but for example, just so caseload wise, I cover 17 counties south of San Antonio.
Wow.
I cover 3. And have to get permission to even try to go as far as she
Really?
reaches, because I feel that MADD tries to give more funding or focus on that, which I respect, you know,
Right.
because we want to help those victims that feel despair.
Right.
They're not feeling the notion of what to do, how to react, what's next, how to process,
I
especially
see.
when they're so overwhelmed with emotions. That's what Analicia is very good about advocating. And
Okay. So I want to break down sort of like the roles and responsibilities that each of you does within the program. So we as a whole can understand the concept of how the program is rolled out, right?
Okay.
So your role encompasses what duties?
I go as a community liaison.
Okay.
Per se.
Okay.
You know, I go out to community events. I go set up a booth, go and speak to parents, go speak to youth. I do presentations, high school, elementaries, junior highs, and I take Analicia was one of my speakers, you know, when I would go out there. So she's seen me hands-on go out there and work. She's come with me to Sherryland High School. She's also gone to Edinburgh North High School. She's gone to different high schools and go advocate, you know, to get ahead of the problem and use also our children to also talk to our adults and say, hey, you know, when you decide to drink and you put your children in the car, it's not only your life you're risking your life and those that are around you out in the roadway.
I see. So it's like the promotion, the awareness, the education.
Educating our community, because we cannot do it by ourselves.
Mm-hmm.
We need our community to help us.
Mm-hmm.
You know, we're all helping each other, and what better way than to go out there to community and say, hey, be my voice in your family.
Mm-hmm.
I can be there at your home, but you be that voice. I go to the university, UTRGV, and I've been approached by students. I'm bringing you my friend because she needs to hear this.
Really?
I'm like in awe. I'm like, okay, so as long as I reach one person,
you're doing your job right.
I feel I'm doing something.
Yes.
You know, I've had community partners, collaborators come and tell me, hey, Maura, I think I heard a comment the other day that an officer says that he feels bad for you for the MADD lady. And I go, why do you say that? And he goes, well, because there hasn't been no DWIs. And I go, darn it, I'm doing my job.
Yes.
You know, I'm doing my job because my voice is getting heard.
Mm-hmm.
People are understanding the message that we want a safe roadway. We want a deathless road someday where there's no crimes, no deaths on the roadway. So my mission is being accomplished.
Right.
So that's our goal.
No cases doesn't mean that it's unsuccessful. It's actually quite the opposite, right?
Yeah. And to me, I mean, to have gotten that compliment from somebody else, it was like,
especially law enforcement, that they have, first responders and all,
Mm-hmm.
and they get first full impact,
Mm-hmm.
right? And then it reverberates into just the layers
exactly
of all the impacted based on that one.
Of that one person.
Of that one choice of that one person.
Of that one
Correct.
person.
So then as community liaison, it's awareness, promotion, education,
Mhm.
and prevention.
Education.
And Analicia?
So my title is Victim Service Specialist,
Mhm.
and I work with victims and survivors. All of our services are 100% free, and until the victim or survivor tells us, hey, don't call us anymore, which they typically do not, we work with them. You know, they're basically like lifetime type of partnerships.
There's
that
really
we
no
have. Right.
cutoff point,
Right.
basically.
No. It's especially given that I was a victim survivor, I can definitely see that perspective, because we used to, when we bump into other victims and survivors, this is a family that you don't want to be a part of. But unfortunately, once you become a part of it, you never escape it.
Yes.
You
Right?
seek that support.
Yes. And so, a lot of these victims and survivors, again, it's not something planned. They weren't accounting to have this loss or this injury, and they need guidance on what to do now, And so we do a lot of advocacy on the criminal justice side. So we accompany them to court, meetings with civil attorneys, prosecutors. Again, most of them have never gone through this. So the lingo, the language, they have no idea what's
Especially
being told
being
to them.
in that
Right.
mourning state or that hurt stage, for them not to comprehend, it's because they can't comprehend nothing else
it's
but
like
the hurt.
in a way it helps with that relatability.
Exactly.
knowing
Like she
that
makes it
someone else has gone
relatable,
through it too as well.
understandable
Yeah.
for them. Yeah.
Yeah.
Mhm.
And so we do a bulk, most of my work is just victim services, providing, and we work with other nonprofits in the community if they're needing assistance with, now we're not working, or the breadwinner is the family member that we lost. I need help with paying the light bill, or, different resources in the community. We partner with other nonprofits. And so we're able to kind of work together in getting the victims and survivors the resources that they need as well.
Wow. That is amazing. So I'm assuming that is the caseload, heavy? Especially if they don't, the interesting part is that, if they never really truly leave the program in a sense, like they're just a part of it now, I'm assuming then the caseload just gets, unfortunately added on. It keeps growing.
Yes. So the caseload is large, but we also have to look at it as criminal cases begin to close, then the need isn't as heavy. And so then what we do post, the closing of the criminal case, what we provide, and when it comes to services, still community resource partners if they need something of that sort. But then we also offer victim impact panels. So victim impact panels is a class that I host, and this is required by the probation department for offenders of DWIs or minors in possession of alcohol are required to attend this class. And I look at them as like dual purpose classes. One, the offender is required to attend and listen and
learn from that and
learn and hear the stories. And it also gives victims and survivors a place to speak. They're able to share their stories and kind of use that as somewhat of a therapy until they're
catharsis or,
and give them some sort of putting a face to the victim, especially to those offenders that think, well, it was somebody I didn't know, so what, right?
They don't think anything.
But when you put them to face and you bring them, it's like they do exist. Now you see a face to a crime that was committed. So I remember back when I was a parole officer, that they would have the new arrival orientation. It was called on parole once a month, and they'd have MADD, and I was like, or the victim impact panel. They would have different victims, and I'm like, wow. And it would be like a 6 to 9 hour process. So it was, we would have them, the offenders go and be there. So they can feel like, okay, you're now in the hot seat, come and see these victims that you victimized because you made that choice.
Right.
Because I could imagine that usually repeat offenders is because they have that disconnect. They don't. They think, it doesn't.
It was a stranger. I don't know them.
It's for the law, for any consequence, and I'm assuming that many offenders too. I would say that there's a little bit of everything. Those that are, that feel the guilt right away, and then those that do not. That do not.
Of remorse.
They don't face them.
The lack of remorse. Right. Right. So MADD works closely, I'm assuming, with law enforcement agencies.
100%.
We do.
And they work hand in hand.
And we have this coming up 4th of July. I know we got an email today with that DA Terry Palacios is going to be having a no refusal weekend, and it's going to start from July 2nd all the way to July 5th.
Can you explain what no refusal weekend means?
Means that if somebody gets arrested under suspicion of any alcohol, the officer doesn't need nothing. The person that is being questioned, interrogated, or stopped, pulled over, cannot say no. It's we believe you're under the impairment. We have a judge on call. They're gonna get the warrant for your blood draw
immediately,
and they have nurses and pathologists to have that ready.
I see.
So it's a whole system. It's ready.
Wow.
So the process moves faster. Just because when you do a DWI stop, law enforcement takes 2 to 3 hours to process. So they're trying to help the process be a smoother ride.
Right.
So, and it also helps the community, give them awareness. Hey, we're doing something about it, but you as a community, help us out.
Right.
Don't let that family member, don't let that person leave your party, your event.
Intoxicated or
there's ride shares. There's so many options out there that there should be nobody operating a motor vehicle under the influence of any substance or alcohol.
So this is maybe like a side question, but is it only drinking that you target?
No, we've also
even though that's the title.
But we've also included marijuana, cannabis now,
cocaine,
cocaine,
prescription drugs,
any form of impairment.
Any form of impairment.
Gotcha. I was going to ask.
Now
that
it's
next.
going to be MADD, Mothers Against Impaired Drivers.
Yeah.
Well, that's kind of why
we're shifting.
We're shifting more to
Oh.
just MADD,
I see.
not Mothers Against Drunk Driving.
Yes.
Mhm.
Yeah, so-
Okay, that's interesting.
And that's what's helping us now when we go out there to educating, because a lot of the schools are like, well, with schools, we don't have alcohol yet, but even though it's a starter drug,
Mhm.
and we always tell that at presentations, it is a starter drug,
Mhm.
whether it's alcohol or it's vaping. I've gotten called to go do a presentation to elementary that even a 4th grader, and the nurse is calling me, and I'm like, oh my goodness, like, how is this
How do we get here?
happening? How are we backpedaling, to these
Yeah.
situations? Well, so we're making awareness, we're educating of that, and also over-the-counter prescriptions, medications of parents having medication, and then it seems easy. Oh, well, let me give you one of these. I already have it. Let's just see.
Yeah.
But at the end of the day, like I told the presentations when I do it, you don't know how that person's going to react.
Mhm.
If in 3-4 hours you're going to be in the hospital and that person is deceased, now you're going to be considered a drug dealer.
Right.
Or a murder without, what is it? Homicide with, you commit a homicide,
Mhm.
So
Mhm.
it's a charge that,
Manslaughter, maybe when they didn't mean it.
and
They didn't mean
not
it.
intentional, right?
Voluntary.
Manslaughter. So then how do we escalate to that so soon with such a simple decision?
Right.
Same
So
as
more
driving.
awareness there,
Yeah.
right?
Yeah.
More awareness
More
there on
awareness.
the sharing of the painkillers, on the sharing of any meds,
Of any meds.
period.
Any medication, there's been people in my classes who are like, well, it was a prescription drug, the doctors prescribed it, and I still got arrested for a DWI. If the bottle says do not operate heavy machinery, that
Don't.
includes a motor vehicle.
What is a car if not a heavy
Yes,
machine?
exactly.
And it's just,
Exactly.
we choose to be technical,
Right.
but it's made in a general version
Right.
because
Right.
doctors don't know what type of career job you do. So
No, they have to
And then some
use
people don't
broad,
read that either.
Right.
No.
broad general wording. Of
Yeah.
course, of
So-
course.
Mhm.
It's just people that don't follow instructions or choose
and
not
I always
to.
go and do my presentations, and I tell the kids, hey, if you see your parents' medication bottles, look at it.
Mhm.
Make your parents aware and say, hey, you as a child are trusting them with your safety. Then tell them hey, let's do a ride share. Let's get Uber to bring us, let's get Walmart to drop off the medication, drop off food, drop off. Nowadays, that's one thing that came out of COVID, right? A positive thing. Now things are being delivered. It's
Right. You don't have to,
Yeah.
not so
need
many
to
people on the
drive.
road.
No need
right.
to put your kids and as the adult in jeopardy. There is no need.
Mhm.
Or somebody else's life in jeopardy.
Mhm.
Yeah.
That is true. Going back to the 4th of July, the no refusal, right?
Yes, no refusal.
Right now, only Hidalgo County has that in place.
So far that we received an email, but it's okay. No refusal is in all cities, counties. It's Texas wide,
Okay.
but it's to the agencies to make it.
Okay.
But it is an ordinance of no
I see.
refusal.
I see. Or maybe like a bit more enforced, especially with 4th of July
Like they
weekend
bring in
coming up.
more enforcement
Right,
during
more to
the
the front.
holidays.
More to the front.
Especially during the 4th of July.
I see.
That is just around the corner, just
see.
next week, right?
Yes.
And I can already see in my city, I've seen a lot more heavy police out there. Like I've seen more on the busier streets. I've seen more busier, especially because it's summer.
Yes.
Mm-hmm.
When I saw it, or that I paid attention because I move from city to city quite a lot.
Yeah.
And obviously I commute to work a lot as well. And I saw that over Memorial Day weekend, there was heavy law enforcement presence throughout,
But
the
that just kind of
expressway.
makes you feel like, okay, they're keeping our roadway safe.
Yes,
Thank
and
you.
it makes also you because it
Be responsible.
even not just because of impairment, but of like not speeding,
Mhm.
Right.
even when you're not under the influence, but like
Shifting
speeding,
lanes.
shifting lanes, being on
Yeah.
your phone. That you kind of
Oh my
swerve.
goodness, the phone too.
Yeah.
Is that
Instructions.
another item that you tackle within, or
No, but I've gone out there where other agencies they kind of. Oh, it's the lady from some other agency was here. She was talking about no phone, no driving. What is the too young to drink or the other one, the other nonprofit that it's called There's another one about driving. The one we did in Ed Couch, Elsa. Do you remember? You remember, right? But okay, we go out there and they do the no text and driving, be safe. So we've partnered up with TxDOT. TxDOT has a lot with that as well.
Information for that.
So I'll have my table and I have the don't drink and drive, and here comes TxDOT with
don't text and drive or don't
text and drive.
right. No screen time during wheel time.
And even the sheriffs. So we've done it where the sheriffs also address it.
I see.
You know, so
it just has to be that collective effort.
It's everything.
And it is a public health issue because at the end of the day, there's crime rate, you know,
Right.
and there's
and statistics don't lie, you know. Statistics don't lie.
Would you mind sharing any statistics with us?
So, again, I cover 17 counties, and I have them kind of by numbered, right? And usually, the higher the number, the more the caseload usually comes from that county.
Right.
And so, number one on my caseload is Hidalgo County. And 2024 TxDOT data for alcohol DUI involved crashes was 752 crashes. And Cameron County and Nueces County tie for second
combined.
Oh.
And they have 383.
Still too
so
high.
just regionally, if we put Hidalgo County, Cameron County together, right? Because we blend into one another.
Of course. And we mesh.
Right.
Yes, exactly.
We're looking at over 1,000 crashes in 1 year. 2024, we had over 1,000 DUI alcohol-involved crashes in our community.
That is...
Yeah.
That's not a good number.
Like,
it's not a good number.
There are only 10 counties on that map, right? And 10 are in red. One of them is Hidalgo County. So that means that our region is up there with metropolitan areas like Dallas,
where there's
Houston,
more people, right?
Yeah.
The probabilities of them being higher is significantly
The fact that
greater.
we're reaching that with our population.
Exactly.
Is alarming.
Yes, it is.
It's
Which
very
means
alarming.
that even though we have less people, more people are doing it here.
Yes.
Mm-hmm.
Yes.
But I mean, glad that we're in this organization and we're doing something, you know, we're being, we're moving forward and positive and educating our community because it's a team effort. I always like to call it a team effort.
100%.
If we don't help each other out, then who's going to help us down the road?
Yes.
You know, who's going to be there to watch us in our roadways with law enforcement? You know, we have to respect them. They're there to protect us. And I always like to go out to schools and tell them, hey, laws are there to be protected. They're not to be broken. They're there to guide us to be better people, better citizens, and have a better way of life, too.
A safer community.
A safer community.
Mm-hmm.
And my opinion, as you were talking, Maura, is I love these podcasts. I'm glad that you have this together. I'm glad that different DA's offices have these different programs and, you know, initiatives. But I really think that the community, we're past the point of hearing that this is a problem.
Mm-hmm.
We're at a point of action. You know, we can no longer hear these statistics and say that's really sad and change the channel.
Right.
We need to...
Oh, okay.
Yeah.
Learned something new today and then go about your day.
Right. Because again, back to the stats, it's 2 out of 3 people will at some point in their lifetime be affected by an impaired driver. So it's not that that's what we want. That's just the reality of it. And so if we're not proactive in actually taking action, you know, in my classes, I tell them I can't keep them accountable. I'm not going to go to their house and check their phone.
Right.
But it's really hard to tell people to use a Lyft or an Uber when they don't even have the applications downloaded on their phone. We have everything else, TikTok, Instagram, Facebook. And then we tell people, hey, when you're going to go out and drink or over this holiday weekend, you know, use a rideshare.
That is so true.
And during the holidays, they tend to have codes, you know, and the DA has been good about sharing those codes and say, hey, utilize these codes. If you and Analicia also in one of her speeches, she says, if you don't have the money, don't be going out. No. Why are you even out at a bar?
You have no reason.
Why are you even purchasing a drink? Yeah. If you feel the ride share is expensive, what are you doing at a bar?
You should be getting some rest to go to work.
You should be at home, watching whatever streaming platform of your choice,
or even having your drink at home and don't leave your home.
That too.
You know
that too. So one takeaway is, if you are going to go out, at least have Uber or have Lyft or have whatever downloaded on your phone.
Yes.
Have those options available for you.
Yes.
Right. Yes. Right. Because sometimes, I mean, it could happen where all of the people present
Right.
are, will partake into whatever it is that's going on.
Right.
But, one has to be safe at least.
Right.
Mhm.
And usually for the most part, we or they, right? We know what we're going out to do, right?
Mhm.
The alcohol doesn't just magically come into our system.
No.
We planned it. We planned
Yeah.
our outfit. We planned what.
Right.
Yes.
We knew who was going to go
Yes.
where, what time we were going to meet. That needs to be a part of our plan.
Right.
We need it to be implemented
How are you
to
going
where
to get
it's
home
natural.
after?
I guess people just think that they arrive and then suddenly plan out
Magically.
no.
And I'm
what
sobered
happened?
up, which
Yeah.
you're not.
Right.
Exactly.
Right.
Yes.
That is an interesting angle to think of. Like, okay,
Yes.
and so what's the plan once you get there? And I don't mean the bar hopping. I mean, how are you going to get back
Right.
home?
Some people only plan the way to get there, not exactly how to get back.
Yeah.
Yeah.
And even if they do, let's say they didn't plan and then they're in the situation, they've had a few drinks. I tell people, I can promise you any bar establishment, any, party that you're attending, they would rather you leave your vehicle and get a ride share at that point. Maybe you didn't think, maybe you were going out to dinner and you thought I'm going to have a steak and, some dessert and a glass of wine.
And it
that glass
escalated.
turned into 2 bottles.
Yeah.
Right?
Yeah.
Okay, maybe that's what happened.
Or you thought you
Leave
were going
your
alone,
vehicle.
and then more friends
More
came
people
by.
came.
Right.
And here
Yes.
come more drinks.
Yeah.
And
Yes.
By the time you
Leave the vehicle there. Go home. Find a way to come and get it once you're sober the next day. Very easy.
Right.
Yeah.
Right. People need to start shifting into that mindset,
Yes.
especially with, I guess people won't take it seriously unless something happens.
When I became an employee, I knew who MADD was because I was a victim who had gotten services.
Right.
But I didn't know who founded it. I
Right.
didn't. So I did my own research on who MADD was because I was going to be in the community advocating, and I wanted to be super concrete on who we were, right? And there was a quote that Candace Lightner, Carrie's mother, made. And it really stuck with me because I do believe it's true that intox manslaughter, which is a charge that you would receive if you kill somebody while intoxicated behind the wheel, intox manslaughter is the only socially accepted form of homicide.
Yes.
Society has accepted it.
They don't bat an eye,
No.
do
No.
they?
And we don't give alcohol the severity that it deserves.
Right.
Right.
And when we go out there when I'm out there in the community, I always talk to parents, and you see people walk by and I'm like, you really need to listen to me. And I'll try to grasp their attention and say, hey, how old were you when you started? And what was the see? So it's a rite of passage. A lot of people see it as a rite of passage.
Harmless.
Harmless.
It's quote unquote.
But
Yes.
yet they start losing interest on the alcohol because I'm over it. I'm done.
Tolerance.
What's next?
You build tolerance.
You build tolerance. And as young people are, their metabolism is a lot more different than the parent.
Right.
And I go back to that also because then as a parent, you want to, I'm going to let me eat that drink. I'm watching her here. But you've opened Pandora's box.
Yes.
I call it Pandora's box because you allowed it. You told her yes here at home. You think she's not going to say yes somewhere else? Or he's going to say yes somewhere else? My mom already told me, I could, so why not?
The idea
right?
that it's okay is already been
And that's what they heard, the yes,
Yeah.
right? That's all the teenager heard,
Right.
or the young
The
adult
permission.
heard.
The permission's there.
Right? So then that goes to that, and then it's like, well, how do we control that? Like, well, tell them the decision of wait till you're 21, wait till your organs are fully matured, wait till you will make that capable decision for yourself, and don't come back to me and telling me, you gave me my first drink. Now look at all the mental disorders or all the issues that I have now. So let's give that responsibility to them, and you be responsible for what's in your household.
Right.
That's
And the
another
example
point.
that you're setting.
The example too. I mean,
Yeah.
yes. And I had a question that kind of like just was brought to mind. So when someone is criminally involved, and I'm talking about also the victim that is going through it too, how is it that they land with you? Does the victim contact you? Or how does it happen? Walk me through the process.
So there's different avenues, right? The victim can call our 1-800 helpline, and that number is 1-877-623-3435. That's 24/7, 365.
I see.
You
Okay.
call that number, an advocate
Somebody
will
will
answer.
Okay.
And then route it to either the community
Like
or the
who's
county
closest
that you live in,
to. I
or
see.
where the crash occurred.
Okay.
That is one route, directly to MADD. Another, civil attorneys. Hey, I got this client. I'm representing them on the civil side. They need guidance on the criminal side. The DA's offices independently will contact us as well. Law enforcement agencies when they
Also.
respond. Yeah, so this is definitely a collaborative effort.
Right.
And that is how the caseload starts building. That is how you get to meet these victims.
And I try to go out to the agency, law enforcement agencies, or make contact with them once a month. And if they're not calling, if I'm not calling them, trust me, they're calling me, and they're reaching out. And then I'm over here bothering Analicia. Hey, Analicia, can we meet up for this? Can we do this? And I'm like, I know you have a busy schedule, so it's hard for us to sometimes.
For sure.
Like, I won't see her probably from now till 4 months or 3 months. Like, we just.
I believe that.
It's difficult.
It's the line
It's
of
just
work
two of
too.
us,
I
yeah.
mean, also
Yes.
the manpower in certain lines of work. Sometimes the need and the want to help is there.
Oh, yeah.
Is 1,000% there,
Mhm.
but you don't have enough hands.
Yeah.
You don't have
Like-
enough hands.
I'm in that situation. I have a dilemma. I'm need to go. They want me to go to an event in San Marcos, but then I have the press conference, and it's like
Which one do I
I
can't
more
be
to the press conference because there's already somebody. I'm just gonna be a support system over here
I see.
compared to over here. It's me putting a face to my community,
Right.
Where I work,
Locally.
where I serve. So it's just like,
But ideally, wouldn't you want to do?
oh yeah, split me
You
into
know?
3, 4, 5 people.
And you see the thing with events, that 100%. I wish that we could be everywhere at the same time. But
Mhm.
something that just came to mind as we were talking is that I think our region, especially being that it's only us two and we cover such a broad area,
With a lot of people
yes,
too.
volunteers.
We're growing.
Oh.
We need
Okay.
volunteers.
Oh yeah, volunteers.
I mean, if we
So-
can help any way to,
Yes. If there's somebody in the community, they don't have to be a victim. They don't
Okay.
have to be a survivor to volunteer. Just being aligned with our mission,
I see.
they can assist us in being.
And how
extra
can they
hands.
find you, or how can they? I don't want to say apply, but
they go
what's
to
the process?
MADD.org volunteer.
Okay,
MADD.org volunteer.
perfect.
Type it on the search volunteer opportunities, and then it goes to the website, and we'll go from there. Or if not, reach out to that MADD.com.
Mhm.
Look for the volunteer search.
And it'll pop up.
Yeah,
I'm assuming that the age registration, they would have to be 18 and over.
18 and over.
Mhm.
I see. That's very interesting
Yes.
because I know that there are people willing, that they might not know, or, they might have heard it in passing, but not
Yes.
concrete. So if
Yeah.
this is an
Right.
opportunity to get you volunteers, because we
Yes.
all need,
We all
We
need
all
that
need help.
assistance. That's
For sure.
And they can call us too if they're having difficulty finding us on a website.
Oh,
call
yeah.
They can
that
also
same
call the hotline.
and then they'll be
Say, hey, I want to
Guided,
volunteer.
directed,
Where
yeah.
are you from? And
now
they'll
on
connect
social
them with
media. Are you on socials?
Yes.
Yes.
MADD
Okay.
Texas.
MADD Texas,
MADD
MADD.org,
National.
MADD National.
Perfect.
Mhm.
So we're if you look, you will find us.
Yes.
It's
That's a good way to put it.
It's
Mhm.
not difficult. MADD.org.
Mhm.
That's the only thing. It's .org. And find us, come, search, look for us. And then our office used to be in Edinburgh. It's not, it's closed down, but
Okay.
there's still contact numbers there. And
Do
call
you
the
have a
1-800.
physical office though?
No.
Okay.
Okay.
Mm-mm.
Okay. That's good to know. In case
Yeah.
anybody is looking for like a
Right.
place to
Right.
check in, I'm sure they would be interested in knowing, like, once I volunteer, how does that look like, right?
yeah.
Is it
Right.
just strictly for events? Is it just strictly for what am I going to do? I'm pretty sure those
Right.
questions pop up all the time.
Right.
But is there any final message that you want to share that we haven't covered yet?
You want to go for that one?
I would say just to take action. Let's be a voice in the community. Let's be that example. Maura deals with the youth. if we're parents, we have eyes that are watching us all the time, and we may forget, but we are setting the example, and they really are the future. We're setting up habits for them and what's acceptable and what is not. Right. And this should be a part of what we're instilling, is that drinking alcohol or consuming any substance does not mix with driving. And if you are, we're not AA. We're not here to tell adults who are over 21 years old to say, never go out and celebrate, never have a drink. But if you are choosing to do that, do it responsibly, make a plan, and be prepared. Have the tools accessible to really make that a reality. Because unfortunately, the stats are high in our area. The concern is great, and we need the community's support in preventing this 100% preventable crime.
And we're helping each other as a community.
We are.
We're not, that's the end goal.
We are.
We want to help each other out. And what better way than take those keys away from that person that is deciding to get behind the wheel impaired. It's a wrong choice. It's a crime. It's not an accident. And another thing I wanted to bring up, Andrea, is that Bentley's Law. Are you familiar with Bentley's Law?
No. Go ahead and explain
Bentley's
it to
Law
us.
is a law that got passed in 2023. In September 2023, and it states that if any person is a drunk driver kills a person, a guardian or a parent, and they have children, they have to pay child support, restitution until that last child turns 18.
Oh, wow.
So let's say you went out and you drank and you killed me and have 4 children plus your children, because you're paying their sustainability.
Now I have 4 new children.
You have 7, total of 7, 3 and 4, so... And I give that example a lot to the youth and to parents also that are unfamiliar. You would be astonished of the deer headlights go off when I mention Bentley's Law. A lot of people are not familiar with it. And I love that law because it really puts responsibility to that person. And what better way than to put it if you have 4 children, 3 children, that's 7 children now you have to support
and feed and
it's a kind of an unbelievable number, because how do you support 7 children, with one family income? It just, to me. So,
but it helps put
perspective.
Put
things into perspective. The responsibility of when you make, as adults, we make the decision to get behind the wheel. And you kill that person that has children. And also
crazy that it was just passed. I mean, I'm sure it was in the works for a long time, but that it was recently passed, because 2023 isn't really that long ago. So,
and it got started in Missouri. So
okay, and it trickled.
Yeah,
it makes sense to me. Why put the victim responsible for something that someone else
give them more hardship that they already have.
Yes,
they're already dealing with that.
That changes the mindset too. Or empowers the victim as well, because you what do you do if that were to happen? You usually the answer would be, I don't know. Right. I have no.
That was my life. I was a minor when my mom was killed, and my dad ended up having to change what he did as a career. He now was doing it on his own, filing for custody, and so having been a minor whose parent was killed, I can see how Bentley's Law has benefited and would have benefited our family.
And that taking initial, care of you and
Thank
your brother.
Thank you for sharing that. That is, I couldn't even imagine. It changes anyone's life.
The hardship that everyone
and
goes
I mean,
through,
also, you can attest for yourself, being a youth and witnessing that, going through that alone. Changes you completely.
Right.
And there's this innocence that no longer is there, because it's such a
wake-up call.
It's such a wake-up call. It's such a wake-up call. Yeah. And it's not, I don't want to say it's often overlooked, but usually you just think about the person that passed.
Yes.
Not the trickling
effect.
Not the whole picture around that.
Well, thank you, ladies, for sharing this information today. I hope this podcast, gets shared far and wide, and we help spread not just the word, because you are right. People do know. People know that drinking or being intoxicated behind the wheel is wrong. Everybody knows it, but we have to start doing something about it. Yeah. So thank you for sharing. Thank you for your time. Again, if they want to find you at MADD
MADD.org.
and they can find you on socials as MADD Texas.
And if not, call us at 1-877-623-3435. That's our MADD hotline. 24 hours a day, 365 days a year.
Perfect. You heard it here at Health Yes Podcast. Thank you very much.
Thank you.
Again, joining us from Mothers Against Drunk Driving. And remember, to everyone watching us, make sure to like and follow us on all of our social medias at CCPH Texas, and also on Spotify at Health Yes. Like, comment, subscribe, hit those notification bells so you don't miss another episode of Health Yes. And remember, stay safe, stay healthy, and stay educated. And we will see you on the next one.